I'm Neal Spears, medical doctor and pediatrician. My personal hobbies, especially over the last couple of years since I turned 40, I've primarily focused on physical activity. If my family, we like to put on weight, and so if we don't stay active, it catches up to us very quickly. So I definitely have a routine and a devotion to physical activity every single day. So I grew up kind of all over the South. I was originally born in Jackson, Mississippi, lived briefly in Plano a long time ago when Plano was barely anything. And then we lived in Albuquerque through my early life, then over to San Antonio until high school, and then I lived in Katy for high school. And then kind of almost went in a big circle, went to A&M for undergrad, and then went to San Antonio for medicine, and then back to Houston at Texas Children's for pediatric training. So basically just kind of all over this whole central Texas region was where I grew up for the most part, aside from that little stint in Albuquerque. So I've been trying to get back to the College Station area pretty much since I finished my training at Texas Children's in 2002. And so I worked in Houston for 3 years, and then we moved out to Smithville for the last 8 years. And I've been I've always kept my eye on this area, but jobs just don't open up every day out here. And so this opportunity with St. Joseph's system is one that I'm very excited about. I really think it's a significant step forward in my professional kind of experience and career path. I feel very strongly about the practice of pediatric medicine and what a pediatrician can bring to a child's life. In particular, special needs children, ADHD children, children who need that kind of specialty level care and chronicity of a provider who's with them over time and can help them through various stages of their development. And so I found in some research and just talking to other people and some shadowing that medicine was probably the best way to marry science with interacting with people and helping people directly. So that led me to at least pursue the practice of medicine. And then I didn't decide on pediatrics until I was in med school and I'd done some hands-on rotations. And I just found that the interaction with the pediatric patient was much more joyful, much more spiritual, much more rewarding than interacting with most of the adult patients. On a bigger picture level, what I really enjoy is over the years and over the continuity of care, seeing young patients grow from their little infant toddler stage of development and then start going and developing and growing, and how my relationship with them evolves and changes with that as they develop as a normal child should. So over the years, over my 12 years of pediatric practice, I really think that's become one of the main things that I enjoy is kind of that evolving and changing relationship between the doctor, the child, and the parent. So as far as my future here with St. Joseph's and in College Station, I think what I'm most excited about is the possibility of teaching more. I really think having interaction on a regular basis with medical students, college students, and med students really helps to keep us current. So my promise to my patients and their families is that I will give them the most honest and truthful advice that modern medicine can offer. I'm very much an academic physician. I very much keep up on reading and go to conferences and try to stay on the cutting edge of what science and the American Academy of Pediatrics recommends.